sir. How are you? My name's Emily. I'm going to be your nurse today.
I'm good.
Just for verification, can you tell me your first name and your age?
My name is Ty, and I'm 25.
All right, Mr. Ty. Looks like you're here for a cardiac vascular assessment. Is that correct?
Yes, ma'am.
All right, sir. Throughout this assessment, you're going to feel me touch in multiple places on your chest and your neck and your lower and upper extremities. If you have any pain or questions, you just let me know, okay?
Okay.
All right. We'll go ahead and get started with the exam. I'm going to wash my hands real quick. First step of this assessment, Mr. Ty, if you'll just go ahead and stick out your arm straight for me. I'm just taking into note that you have nice symmetry in your arms. Your hair distribution is nice and even. Your skin color is nice, warm, and dry. There's no tenderness when I touch, correct?
Correct.
And your skin tuger is good. It bounces back. I want you to go ahead and squeeze my hands for me. Good. That's just checking your hand grip. Next thing we're going to do is we're going to flip your hands palm side up, and I'm going to palpate some arteries, okay?
Okay.
So on this side, you have your radial, okay? You also have one on this side, it's a radial artery. And on the insides of your arm, right here, you have your brachial artery, and right here on this side as well, you have a brachial artery, okay?
Okay.
All right, Mr. Smith, you can go ahead and lay your arms down. Next step, we're going to move towards your neck. I'm just taking into note you don't have any lumps, bumps, bruises, any tenderness when you swallow. No? Okay. So I'm going to be palpating your what's called your carotid arteries, okay? I'm going to be moving fairly quick through this part because I don't want to block any blood flow, okay? So you have one there, and other side. All right, Mr. Smith. So this time I'm going to be listening with the bell or the small end of my stethoscope. For this point or this part, I want you to take a nice deep breath in and hold it for me, okay? All right. Nice deep breath in and hold it. All right, perfect. You can breathe. And we're going to move to the other side. Nice deep breath in and hold it. All right, Mr. Smith, you can go ahead and relax. Next part, I'm going to be moving down to your chest, okay? I'm going to be doing some teaching, and I'm going to be palpating these parts of your chest, as well as listening with both sides of my stethoscope, okay?
Okay.
All right, so on your second intercostal space, right chest wall, you have your aortic. Second intercostal space, left chest wall, you have your pulmonic. Third intercostal space, left sternal border, you have your Erb's point. Fourth intercostal space, left sternal border, you have your tricuspid. And fifth intercostal space, mid-clavicular, you have your mitral, okay? Now I'm going to be naming those off as well as listening, okay? We're going to start with the bell or the small side first.
Okay.
So you have your aortic, pulmonic, Erb's point, tricuspid, and mitral. Now with the diaphragm, aortic, pulmonic, Erb's point, tricuspid, and mitral. All right, Mr. Smith. Now what I want you to do is lay your head flat on that pillow for me. We're going to be checking for what's called jugular vein distension, okay?
Okay.
So I want you to go ahead and turn your neck towards this side, towards the wall, please. And we're just taking into note that you don't have any jugular vein distension. Flip your head that way for me. And then note it on this side either, okay? Next part I'm going to be doing is I'm going to be moving to your chest area or the pericardium, okay? That's the muscle that surrounds your heart. I'm just noting that there is no lumps, bumps, or bruises in this area of your chest, okay? Now I'm going to be listening, and I'm going to be palpating again on these points of your chest as well, okay?
Okay.
So, second intercostal space, left chest wall, you have your aortic. Second intercostal space, right chest wall, you have your pulmonic. Third intercostal space, left sternal border, you have your Erb's point. Fourth intercostal space, left sternal border, you have your tricuspid. And fifth intercostal space, mid-clavicular line, you have your mitral. As well, you have your apical pulses felt here, okay?
Okay.
Now I'm going to be listening. Bell side first. You have your aortic, pulmonic, Erb's point, tricuspid, and mitral. Moving on with the diaphragm, aortic, pulmonic, Erb's point, tricuspid, and mitral. Now, Mr. Smith, I want you to go ahead and turn towards the wall for me with your arms this way. Completely turn on your side, sorry. And put this arm out. Perfect. And that is your mitral, fifth intercostal space, midclavicular line, mitral, okay? You can go ahead and continue to lay flat on your back for me, Mr. Smith. And we're going to be moving down to your lower extremities, okay?
Okay.
All right. So I'm just taking it to note that your legs are nice and symmetrical. You have even hair distribution. Your skin is nice and warm to the touch. There is no obvious varicose veins anywhere, and you have no edema in either extremity, okay? Any tenderness?
No, ma'am.
No? Okay. So you also have some arteries in your lower extremities. I'm going to palpate those now, okay? So you have your femoral. Behind your knee, you have your popliteal. On the insides of your ankles here, you have what's called your posterior tibia. And on the tops of your feet, you have your dorsalis pedis, okay?
Okay.
All right, Mr. Smith, that concludes our exam. Do you have any questions for me, sir?
No, ma'am.
No? Okay, thank you. I'm going to be giving report on a 25-year-old male who came in for a cardiac vascular assessment. Upon inspection of the upper extremities, it is noted that the patient has symmetry, not symmetry. Hair distribution is even. Skin is nice and warm. Skin turgor is perfect, bounces back. There's no tenderness in the upper extremities when palpated. The radial and brachial pulses were both found with no thrills or bounding noted. Moving on to the neck, there was no lumps, bumps, bruises, obvious thrills or pulsations in the note. Carotids were palpable and equal on each side. They were also heard with the bell end of the stethoscope. Patient states there's no pain or any murmurs are heard. Moving on to the chest, patient had no obvious thrills or murmurs heard, no tenderness on palpation when pointing out the valves to patient, as well as moving on to the jugular vein distension. There was none on either side. There were no obvious pulsations or thrills noted, as well as any murmurs when listening with bell and diaphragm. Moving on to the lower extremities, hair distribution and symmetry is noted to be nice and intact. There is no varicose veins, any edema, palpable edema, or tenderness. Patient also notes that there is no tenderness when palpating. When palpating the femoral, popliteal, dorsalis pedis, and posterior tibula arteries and valves, there is no pain or any deficits or irregularities noted.